Gum disease is a bacterial disease of your gums. Your mouth is full of bacteria, and some of this bacteria will lodge in the pocket or around the surface of the gums, where the gums and the tooth meet. Over a period of time, this bacteria releases toxins. These toxins dissolve away and destroy the ligaments that hold your teeth in place. These ligaments go between the tooth and the bone of your jaw. Over a period of time, these ligaments get destroyed, the bone of your jaw gets destroyed, and over decades your teeth then become loose and fall out. The reason for trying to keep this gum disease at bay is to reduce the risk of tooth loss and to reduce the risk of periodontal damage. That means damage to the ligaments and to the bone of your jaw. Whenever we do gum treatments, we take away that bacteria that will destroy the periodontal ligaments, the ligaments between the tooth and the gum, tooth and the bone, and the bone that holds your teeth in place. What we really need to do is to teach you, sounds very babyish, but to teach you how to clean your teeth. It's very well coming to the hygienist every 3 months and 6 months, but the vast majority of the time, whenever you're at home, gum disease is establishing itself. And what you need to do from an oral hygiene point of view is to minimize that gum disease. We can do this every 3 months, we can clean your teeth every 3 months, but the more you do at home, the less we have to do here. Gum disease is a bacterial disease of your gums. Gum disease comes in 2 different names. Gingivitis. Itis is the word for inflammation. Gingivitis is the inflammation of your gingiva. Your gingiva is your gums. So gingivitis is the inflammation of your gums. That is the start of gum disease. If gingivitis gets worse and the bacteria penetrates past the upper layers of the gums, it will change, the disease will change into periodontitis. Periodontitis is the inflammation of the periodontium. The periodontium consists of the ligaments that hold your bone to the tooth, your gums, and your jawbone. Periodontitis is the major cause of tooth loss across the world. Gum disease presents itself as red gums, bleeding gums, swollen gums. If you brush your teeth at night or morning and there's bleeding, you have gum disease. Now people turn around and say, oh, my gums are bleeding, what's the big deal? If you take the surface area of your gums, it is around about the size of the palm of your hand. If the palm of your hand was bleeding every time you touched it, would you be concerned? Probably. But that is happening every single time you brush your teeth if there's bleeding. It is an open wound. The other significant part of gum disease is it is linked to systemic diseases like cancer, pancreatic cancer, cardiovascular disease, strokes, Alzheimer's disease, asthma. All systemic inflammatory diseases are linked to gum disease, including diabetes and including all the other systemic diseases that we're only just finding out about. So it's vitally important from a home point of view to maintain your oral hygiene. This also reduces your risk of systemic inflammatory diseases. Smoking is a massive contributor to gum disease. It stops the healing process of the gums, it masks the disease itself, and it is the major contributory factor of gum disease. There are a few other contributory factors. As I say, smoking is the main one. Hereditary factors. Did your mum and dad, did they have teeth in their 40s and 50s? Used to be called pyorrhea back in the day. And if they've lost their teeth at an early age, you're prone to gum disease as a sibling or as a child. It is vitally important to maintain oral hygiene. In the same way as there may be heart disease in your family. If there's gum disease in your family, it is something that you need to look out for and need to maintain good oral hygiene. Just by having heart disease in your family doesn't mean you're going to have a heart attack or a stroke. If you look after your health, if you look after your diet, in the same way, if you look after your gums and look after your oral hygiene, that does not mean you're going to have gum disease, but you are at a higher risk.
So if you notice that your gums are bleeding, that you have recession, that your gums are red and shiny, that's possibly an indication that you need to come and see, first of all, the dentist and then in to see the hygienist.
If you'd like to make an appointment at Gallagher Dental, you can do so by phoning us on 01 678 8158. Alternatively, email us at info@gadental.com, or you can visit our website and book online. The website address is www.gaadental.com. We look forward to having you as a patient, and we'd love to see you and hopefully have a long and rewarding relationship with you.